Hello, my name is Dr. Nada Shawi. I am a teaching assistant at the Faculty of Nursing, Riyadh University. I'm going to be demonstrating to you here today a couple of exercises. They're mainly for frozen shoulder for diabetic patients. These exercises are to help them to relieve the pain, to relieve the stress, and also to relieve the stiffness of the shoulder. Today, I will be having a couple of students that will be acting as my patient. I just want to explain that there are some rules before beginning these exercises. First of all, you have to take a shower, a warm shower from 10 to 15 minutes. Also, you can't, if you have any pain, of any sensation of pain, you have to stop immediately and call the physician or the nurse that are attending you. Also, we have something else. When performing the exercise, each exercise is performed from 5 to 10 times. We have to hold our position for 15 seconds or 10 seconds at least before removing ourselves or relieving our pain, okay? For our first exercise, it's called flexion and extension with rod or band. We're going to need a rod or band in our hands. We can be sitting or standing. Either way, it's okay. First of all, we're gonna hold the band or rod in our hands, flex our hands straight in 90 degrees, and then start to flex it or make a flexion with it, simply and gradually, gently, without causing any pain. If you reach here, stay 5 seconds. Then complete to stay up, go up as far as you can until you go all the way to the back. And then stay 5 to 10 seconds. Hold, and then you can release. This is our first exercise. Our student here will repeat it. Try it. Flex your hands. Flex it. And then start gently, gently, slowly and gently. Slowly, gently. Hold for 5 or 10 seconds. Then start over your head. Over your head. Hold for 5 or 10 seconds. Okay, release. For our second exercise, it's called a pendulum stretch. For this exercise, we need to relax our shoulder first, put our not affected arm on a table or a chair or any object, and then hang our hand, our affected arm, this is our affected shoulder, and then hang it here, and slowly, gently make a clockwise and unclockwise with our hands to move our shoulder in circular motion or upward, downward. It doesn't matter unless it's in 30 degrees. Our student here will repeat the exercise. Put your not affected shoulder, and then our affected shoulder, relax your shoulder, and then move it in circular motion, slowly, gently, and then down, up and down, like this, yes, and in circular motion. Repeat this exercise from 5 to 10 times. Okay, and stop. For our third exercise, it's called a towel stretch. What is a towel stretch? We need a towel. We're gonna make our affected hand downward behind our back, and our straight hand or healthy hand, healthy shoulder, we're gonna take the towel, make it from behind, put our affected arm here, and start to pull. Pull it for 5 to 10 seconds. Hold, and then release, gently. Now downward for 5 to 10 seconds, and then release. Our student here will repeat this exercise. Take your towel. Okay, now hold it with your affected shoulder, with your healthy shoulder. Take it upward as far as you can for 5 to 10 seconds. Hold upward, and then release downward as far as you can from 5 to 10 seconds, and then release. For our fourth exercise, this is called a finger walk. We need to put our hands, our affected shoulder, straight to the wall, and then with our fingers, walk gently, upward as far as I can to make my shoulder spread, and then go downward. Hold here for 5 seconds, and then go downward with my fingers as far as I can. Okay? Our student here will repeat this exercise. Come on. Stand straight with your affected shoulder to the wall. Okay? Finger walk until you can. As far as you can. Hold for 5 to 10 seconds and then release downward, downward as far as you can. For our fifth exercise, it's called a cross body reach. First, we need to sit and then use our healthy shoulder, our healthy hand to gently take our shoulder and then press it until it's hugging me. It's called a hugging situation. You can make it like this to make our affected shoulder in this degree. Hold for 20 seconds and then release. Our student here will repeat. Our healthy shoulder, our affected shoulder. You're gonna take this hand this way and then pull it until you hug yourself. Hold for 20 seconds and then release. Again, take your healthy. Okay, stretch it. Okay, hold for 20 seconds and then release. Okay. For our sixth exercise, it's called an armpit stretch. We need a table in front of us, and then we're gonna straight our hands, both of our hands, our affected shoulder and our healthy shoulder. Put it on the table, and then gently go down. Flex your knees and go down to increase the angle between our shoulder and our armpit. Stay here for 10 seconds and then go up. Okay, our student here will repeat this exercise. Go on. Okay, with your back straight and your hands straight. Okay, hold and then go up with your hands straight. Okay, excellent. For this exercise, it's called inward rotation with band. First of all, we need a door handle, a bed, anything that I can tie my band to first, and then with my elbows at 90 degrees. This is my affected shoulder, this is my healthy shoulder. I'll do this with my affected shoulder from 90 degrees and inward to my body. Inward to my body. Okay? Can you repeat? Okay? With your elbow, 90 degrees, and then stretch it all the way to your body. Okay? Repeat this exercise from 5 to 10 times. Okay. Excellent. This exercise is called outward rotation with band. We're going to need a rubber band, and then with both of our hands, our healthy shoulder, our affected shoulder. We're gonna put it like this, and then outward, we're gonna stretch our hand. And repeat, outward, stretch our hand. From 5 to 10 times. Can you repeat? Okay, with your both of your hands. كده. Outward, flex it like this. Okay, stretch as possible, stretch. Okay, repeat. Excellent. For our last exercise, it's called active assisted flexion. For our affected arm, we're gonna put it near us, and with our healthy arm, we're gonna take our hand, put it on our elbow, and then increase the degree. Increase and help to assist it upward. Upward, as possible as I can. Hold from 5 to 10 seconds, and then release, slowly and gently. Okay, repeat it. Okay, this is our affected arm, this is our healthy arm. Take your hand, put it on under your elbow, increase as possible. Okay, hold from 5 to 10 seconds, and then release gently. Release. Okay.